Hi, this is Group Three's presentation. The group members are Anjana, Anu, Prithvi, and Rucha. Our topic for today is diabetes. What is type 1 diabetes? When the pancreas produces the insulin cell and these insulin cells are destroyed by the body's immune system, this basically increases the sugar level in the blood because the insulin is destroyed and it cannot convert these carbohydrates, so they get deposited in the blood and the blood sugar level rises. This results in type 1 diabetes, and type 1 diabetes is very common in young adults and children. The cause for type 1 diabetes is mostly genetic and environmental factors. There are treatments available, like lifelong insulin therapy is required to treat type 1 diabetes. What are the symptoms of type 1 diabetes in adults and children? Increased thirst, excessive hunger, weight loss, blurred vision, slow healing of cuts and burns, feeling tired or having the fatigue all the time, bacterial infection, and frequent urination. What are the effects of diabetes? Basically, if the insulin is not present, the carbohydrates are not broken down into energy and the body doesn't get the sufficient uh, amount of energy required for the growth. Hence, there is a reduced or stunned growth, as well as the puberty is delayed. The blood vessels, eyes, and kidneys and nerves are destroyed because of type 1 diabetes. The GI tract also gets affected because of the therapy. The factors important in devising a realistic care plan. The first thing is insulin. The quantity and quality of insulin should be monitored, and it should be consumed timely and in the prescribed dosage. Then the medication, what kind of medication a person should have depends on their health and also different biological factors. Quantity and time at which medicines is consumed, it is very crucial. And who prescribes the medicine, a doctor or a pharmacist? Then continuous glucose monitoring and insulin pump. One needs to know how to use the equipments, as well as if these equipments don't work, like if the insulin pump doesn't work, then there should be a backup option so that your health doesn't get deteriorated or you are not affected because of it. um, then the supplies or the equipments that you're using should always be sterilized. The battery should be changed whenever needed. And the precautions that are to be taken: patients should consume more of green leafy vegetable, including spinach and broccoli. Try to avoid canned food and processed food. It's difficult, but it's not impossible. And then, since it is diabetes, of course, one needs to control the sugar level and try to eat a balanced diet. And of course, like, physical activity is always important. And in case of anyone, just let the doctor know. Communication among healthcare professionals, text messages, chat, email, phone call, All these things helps in notifying each other about patient situation or appointments. Easy and convenient web meetings and conference for in-person discussion. Easy to do FaceTime between people of different location and share concerns and ensure more care to patients. Apps helps to notify patients and their clients about the next meeting and make sure they don't miss and follow-ups. Also used by medical practitioners to provide prescriptions. Online database provides the safest method to store the data of patients. Follow-up care. Ongoing education, monitoring, and support is needed. Helps to prevent complication and maintain a good quality of life. Provide proper education. Helps setting goals. Encourage self-care. Provide resources and monitoring progress. These are a few references that we have used to make this presentation. Thank you from all the group members.